Great. Right. Good afternoon, everyone. Um, Thanks for joining this live session. Um, just so I bring it to your attention, if you're just joining, please remember if you're not a subscriber, you will not be able to put your question forward. So, to be able to ask question, please be aware you will need to be a subscriber. So please be aware that for you to be able to put your question forward, you will need to be a subscriber. Um, okay, great. So just give me a second so I can talk you through. Um, I can see that there's already 5 people here. So just before every other individual join us, it's going to be an interesting session today. Just before others join, can you just put forward your name and what you're looking to get out of today's session, please? If you can just put forward your name and what you're looking to get out of today's session, just put in the chat box. So if you can just put forward your name and what you're looking to get from today's session. So I will share my screen soon. So this is what we're going to be covering today. Um, so for today, I will be going through things around, when you should actually start applying for your NHS role, particularly those of you that are very, very keen on sponsored opportunity within the NHS. That's fundamental. That sponsorship is quite very fundamental to part of your pathway to staying in the United Kingdom. And also, those of you that are now probably at a very critical stage within your visa phase as well. Also, how do you also search for COS roles, jobs that have a COS opportunity? And particularly speaking, I will be looking at roles that are not care related jobs. So we're looking at purely administrative opportunity within the NHS. So how do you actually search for those jobs opportunity? And what are the things you need to look out for? And I will be talking you through some of the common mistakes and perceptions that people have. When you look at jobs opportunity in the NHS, you misinterpret the opportunities that comes with those roles. Do they actually have sponsorship written in them to indicate that they can sponsor, or these are just purely administrative error from the HR when the job is being put out and you just assume that the job is a sponsored role anyway. Um, and you just assume the roles are sponsored opportunity within the NHS anyway. So how do you actually how are you able to discern between jobs that are sponsored opportunity and jobs that are non-sponsored opportunity within the NHS? Also, I will also be walking you through the shortage occupation list as well today. And how do you apply for COS after there's been a job offer from your trust? What are the kind of I will be walking you through email templates, how to sort of construct your email so you can approach your HR with the support of your manager to get that sponsorship in place. So, what are the things you need to put in place to make that realistic and achievable? So, before we get going quite fully to the position where we can open up the discussion, I'm quite very conscious of time. I do not intend to take too much of your time. This is meant to be a quick stream, just to walk you through some of those opportunity. Just for this reason, just to get to know anyone. So I've seen a message from Zainab. A few of you other guys that are here today, can you just put your um the reason why you're here today, what you're looking to gain from this session, and what if you have question as well, please also remember you need to be a subscriber to be able to ask a question. So please do put forward an introduction of yourself, um, why you are here today, and what you're looking to gain as well. So all right. So yes, so we've got someone that is really excited about the opportunity for um, data analyst role within the NHS. If I may ask you, are you currently purely allowed food? Are you currently a data analyst, or this is something you're still aspiring to be part of? Where are you right now? What are you currently doing? So if I may put that forward as a question to you. So if you're able to chat to put that in the chat box, then at least I can know where to take it forward from. Um, okay, so great. So thanks. I presently working as a customer agent in the UK, so that's great. So not a problem at all. That's fine. I'm sure there are many transferable skills you can take from your current role, and there are many transferable skills you can take from your current role and take it into your job in the NHS to build on that opportunity for the career path you're looking for. Yeah. So Rukayat want a role that will give COS. That's fine. Um, Lara Onilola, good afternoon. I'm Lara, looking for how to get a COS after starting at NHS. So, Lara, if I may ask, are you currently working in the NHS, or you're still in the process of joining the NHS? So, where are you right now? What's your position in terms of your job opportunity, or are you still studying? What are you currently doing? So, where are you presently? So, Lara, are you currently working in the NHS, or you're just about to join the NHS? So, where are you presently in terms of that, in terms of your career search? Okay, I'll pick it up later. Um, right. So today, so again, just to sort of reiterate what we're going to be looking at today. So when to actually start applying for sponsored role in the NHS, how to search for COS roles in the NHS. We're going to be reviewing the shortage occupation list, and also how do you apply for your COS after a job offer confirmation with NHS. So what sort of emails do you need to send to your manager to put in a request for your COS? And the reason why this is also very crucial is because There has been many occasions where I have spoken to people, and one of the common mistakes they do make is one of the common mistakes they do make is this: you do go on to your manager and you start giving your manager all sort of code that are there in the NHS, 1487, 14910, all this code that your manager have no clue about, especially if you have to think about it this way. A lot of these managers are British citizens. They do not have any personal um, understanding. I think it's just because of the way the immigration system is right now and the influx of, a lot of international students and influx of international nurses into the NHS. As this is why a lot of the training around immigration, permit to work, right to work, has now been broadened within the NHS. So a lot of managers, very, very rare would you ever come across a seasoned manager that have a clear understanding of what he or she needs to do to help you to achieve your sponsorship. So a lot of managers have no clue what this whole sponsorship thing is all about. So you have to guide them. And the best way to guide someone is by simplifying the process to them as much as possible. It's not your job to complicate it any further. So, if you think about it, the life of a manager is as complicated as it is already. They have their own personal life to manage. They have to support you and colleagues alike. They have to do their day-to-day job. They have to do also. They have all sort of responsibility and burden on them. And in addition to this, you expect them to know the right kind of code that will get you sponsored. So if you're very fair to your manager, rather than assuming that your manager should know all these things, why don't you make life simpler for your manager by guiding them through the process and by walking them through the process? And by doing so, you're able to then get yourself what you want to achieve, and likewise as well, make the life of your manager easier as part of the necessary supports that will be there for you. And also, you have to take into account that there will be circumstances where your manager will have no interest at all, or in any circumstances, it could also be the other way around where your manager have a great deal of interest, but the HR will not support in any capacity. And these are also possibilities that you need to take into account that could happen. So never ever be so confident or reliant on the fact that you've joined a trust and automatically, because the salary threshold of the job has been met, that in effect should earn you a sponsored role. That doesn't happen that way. So there are numbers of things that do come into effect, particularly when it comes to you attaining your sponsorship opportunity. So um and these are the things I will be discussing with you today, the strategy you need to put in place. So, does anybody else as well, anyone on the live stream, do you want to come inside the chat box, introduce yourself? What are you looking to gain today? I'm hoping we will get into the full session in the next 5 to 10 minutes, and we will start discussing some of the key body of the presentation today. And I'm definitely sure, like many presentations from past, you will find it worthwhile. So it's something that I think you need to pay an attention to today. um Yes, I did get your response, Lara. So yeah, thanks for that. So I'm sure we've also spoken before as well. So you probably should be fine in your own particular field. So does anybody else want to come forward to introduce themselves and also, why they're here today, what they're looking to gain, and how they intend to make this a reality? So these are the things we'll be covering today. We'll be focusing so much on the shortage occupation list, and the reason why I've actually put this together is because I want this strategy, which is specifically for those that are probably coming close to exhausting um, their post-study visa. These are the kind of strategy you can put in place to help you immediately achieve that goal and that objective of your sponsored role. And particularly looking at the trust that will give you the sponsorship you need, rather than just applying randomly to different hospitals at different times in different capacities. So, how do you make sure you have a laser focus on hospitals that have sponsorship opportunity for you, and you focus solely on hospitals that and jobs particularly that will get you the sponsored, that will meet the threshold from the sponsorship? Because as a student, you have two options there for you. or if I may say, as amongst those two options are various sub opportunities that come with it. So let's look at what actually happens as a student in these whole entire situation. So as a student, there's core two things that applies to you. Either you go through the shortage occupation list number one, or number two, you gain your sponsorship through meeting the salary threshold, which presently, as you know, based on the law that changed last year, I think it was last year, April, based on the law changing last year, April. The law that apply to you now are quite very straightforward. It's twofold. Either the 30,960 pathway, or you achieve your sponsorship through the 38,700. And majority of you will probably be able to achieve the 38,700, but you know the pressure that will take, particularly having to go from either a band 5 role, which in most circumstances, some of you, your entry point in NHS would be either band 4 or band 5, and majority of the band 5 do not meet the salary threshold in any capacity. So what does that mean for you? You have to take on that role, do that job for maybe another 6 months, and then you look for an opportunity for career progression in another hospital if the opportunity is not forthcoming in your existing trust. So what that meant in effect is you've gone on to take on a role of a band 5, you have to do it for 6 months, and then you have to start searching for your sponsored role, either band 6 or band 7 in another hospital. And if you search for a band 6 in London particularly, you will meet the threshold, because band 6 in London particularly in a certain area where there is high cost living, high cost allowances added to your salary, you will meet the threshold of the 38,700. But if you were to go to a band 6 outside of London, starting from 35, 36 thereabouts, you will also meet the threshold of the 30,960. So these are all the things I'll be looking at today with you, and I will give you all the strategy how to actually develop a plan for yourself and how to make all these a reality in terms of your pursuit. And this is very, very fundamental. And the essence of this is about making sure you can benefit from all your investments, particularly leaving Nigeria, coming to the UK or whatever African country you've actually migrated from. So if you're happy to come inside the chat box, remember, for you to be able to put question forward, you have to be a subscriber, and you have to be subscribed for at least a minute. So if you're happy to do that, please do come in the box, in the search, in the chat box, and put your question forward, and put an introduction forward, and I will take it from there. So yeah, is there anyone happy to introduce themselves? Right. So we've got 4 minutes. In the next 4 minutes, I will be going into the in the next 4 minutes, I will be starting the presentation. Um, so yeah, is there anybody else who's joined now that is happy to come forward and introduce themselves? So we've got about 4 minutes, and hopefully we can get that introduction out of the way. Um, I'm glad those of you that are here today. I'm glad to see you here, and I'm very much aware. Those of you that have attended previous webinars that has been hosted on Teams, just as previous sessions as well, you've always found it to be worthwhile, and I'm sure this session today will not be any different. There are significant amount of benefits that will be coming from it. It's going to be a very quick live stream, and I hope some of the discussions we're going to be having today will be something that you can take forward and utilize as part of your own job search objectives. And for those of you that are already in the WhatsApp group, definitely you can reach out to me for further clarification on anything. So, okay, so I think for the sake of time, the best thing to do now is probably let's get into the session. and we can if there are some of you that definitely will have questions you want to ask, please start preparing your questions now, and start putting your questions together. So at the end of this stream, excuse me, start putting your questions together. So at the end of these, at the end of the session, you can then um, get to ask your question, and I can also take time to also answer all the necessary questions as well. Please also bear in mind, please be very, very careful not to type anything that could be just make sure you're very aware that you are in a public space. Really, that's pretty much all I have to say. Just be very much aware that you're in a public space. uh Great. Okay, so all right, so let's go into the session now. um the first question we'll be looking at today is, when should you actually start applying for your sponsored role in the NHS? So this is one of the most common questions I've been asked on numerous occasions. Particularly, from an international student point of view, there are times where you think, okay, I'm going to leave Nigeria, I will come to UK. Irrespective, I will be fine. As soon as I'm done with my academic program, I will land a job of my choice. Yes, for some people that dream and vision will always be a reality. But what I can tell you today is, for most people, that reality might never ever happen unless you have a plan in place. And the best way to make life easier for yourself is by having a plan. And what does having a plan actually looks like? It actually means you understand the kind of environment you're coming into. A lot of people are leaving Nigeria with absolutely little to no knowledge of what this country is all about. You don't have any understanding of the job market. You don't have any understanding of what actually your recruiters are looking for. You don't have understanding of what actually, as an individual, where do you fit in terms of the opportunities that are available to you in this country. And you've then had an assumption that because you've achieved series of incredible things in your home country, particularly in Nigeria, where you assume because you were previously a manager, you were previously a senior personnel in any organization you're working, and by default, when you get here, that should translate into similar opportunities. But one thing I would like to say to you is, you could have all those attributes, all those achievements, and all those qualifications, and still come here and still find it difficult to attain any respectable position. So, understanding the fact that, when you're in Rome, you behave like a Roman, and coming to that realization that you've come to a different country where you might need guidance, advice, and also, most fundamentally here as well, is that you've come into a country where opportunity for development is always directly linked to the way the system is structured. And what does this actually mean? In some circumstances, you will have to leave your comfort zone, particularly your geographical area. You have to migrate outside of your geographical area in order to get to what you want, first and foremost. Secondly, the kind of job you aspire for might actually never be attainable. And in that respect, what does that mean for you? Is about looking for other roles and opportunity where your skills could be best deployed and best utilized. And in order for you to be able to do that, I'll give you a very good example here. I've seen circumstances where people have banking and accounting experience in Nigeria, and they have that great passion for the job. No question about that at all. And you will come into UK, you submit tons of applications for different banking, accounting role, financial related role. You might get interviews here and there, but those interviews might never amount to any positive outcome. And in the process of wasting your time trying to search for those jobs, your visa is constantly counting, your time is going, you have limited opportunity now, particularly in the fact that, the longer you're applying, the more demoralized you become, and the more possibly the job you're doing, which might probably not fit the right profile for you, the longer you're staying in that job, and the more you stay longer in a job that actually does not have any substantial contribution in terms of career progression, the more your profile diminishes. So, other than battling a fighting a battle you might never win, or knocking on a door that will never open, you might actually not just realize that you could be best positioned to go into other roles that have better things to serve in terms of your career development. And what are these kind of roles I'm talking about? In the process of you searching for your banking role, there are many, many, many skills, particularly in your areas around, if you give and take, for example, particular skills around managing staff, the undertaking performance appraisals. If you look at your skills in terms of working to deadline, operational responsibility, administrative function you've performed in that role, you could take it to numerous jobs within the NHS. You could be a business manager, you could be a support officer, you could be an administration manager, you could be a patient pathway coordinator. You could also go on to become, service and operational manager. And all these, particularly, are the kind of roles that, you yourself will find yourself not realizing that you could take your skills into. And by failing to do so, you then end up in a position whereby you've actually shut a lot of doors on yourself before you realize that, some of the things you're pursuing might actually not be realistic. Because this is a country where, I'll just to give you an analysis, for example. A lot of you here, either you're a student or you're not a student, just think about it. In your class, for example, think about people that graduated before you, thousands of people coming into this summer now. We have people that are graduating coming into this January gone by. There are people that have graduated coming into this May. There are people waiting for their graduation. So there are thousands of people graduating every year. And these are brilliant individuals, which in some circumstances they do not need sponsorship. They are British citizens, or they have the right to remain in the country. They've You've gone to attend a first class. Let me paint a scenario of that kind. They themselves, they've gone on to attend a first class. Worst case scenario, let's assume they've come out with a pass in their academic during their master's degree. You've come out with a distinction, but they always have one advantage over you. They have the right to remain in the country. So if any manager is making a decision, they still stand as a favorable candidate, unless there's a genuine reason that, those individuals are not going to perform up to the standard they need. But looking at the picture in front of the manager will probably best look at what is in the long-term interest of the department, particularly knowing that if they're not able to sponsor you, best case scenario, you'll be with them for 2 years. Now they've invested heavily in you, i.e., through the training, all those kind of resources they will invest in you. And what's going to happen afterwards? You're definitely going to have to leave the department if they know they can't sponsor you. So the managers will always make those strategic decisions, looking at what actually is here for the long term of the organization. And if you put that option in front of them, like any reasonable individual, they will look at the individual that have the right to remain, rather than having to sit down here and then battle through the process of going through the same stage they did for you in terms of your recruitment over the course of the next 2 years again when you leave. So ideally, when should you actually start applying for sponsored roles within the NHS? The best advice is, before you leave Nigeria, you should actually have been looking for job opportunities within the public sector, particularly NHS. It doesn't matter if the first job you attain during your 20 hours is that of healthcare assistant. If it's any band two role, if it's a porter, if it's anything, there are numbers of things you can do when you lay your hand on your NHS email account that will upskill you and propel you towards the career progression you're looking for. So, what do you actually do in here? When should you start? You should never, ideally, some of you would have waited until the end of your degree, and you will be very fortunate to attain the role you're looking for. But don't ever leave anything to chances. Start applying before you enter your dissertation phase. If you cannot secure a bank role with NHS, first and foremost, or you cannot secure a 20-hour roles, make sure that your next plan is, before you actually hand in your dissertation, 3 months before the end of before your dissertation is due, start your application process. Yes, I do understand it's very difficult having to write dissertation, do the research, do your job you're doing. Some of you might be working in healthcare or whatever job in the warehouse or any other roles you're doing, balancing that out, writing your dissertation, and then putting application forward. But this is where your ability to handle challenging circumstances is heavily challenged. This is where your ability to work under pressure is challenged, and this is where your ability to endure is also challenged. And this environment will challenge you to the beyond the point which you actually even might recognize this is the kind of person you are, or you have this level of tolerance. So ideally, your application should have commenced in any shape or form before you enter your dissertation phase if you are already not working in the NHS. So before entering your dissertation phase, start putting forward your application, even if it's a band 3, band 4, band 5, band 6 position. Start constructing a very, very detailed supporting statement that covers all your skills, your achievements, your development, your progression, and whatever you've attained. Some of you might be fortunate enough to have an active role in your university, either through the union. Some of you will have an active responsibility through leading the Nigerian society in your university. There are many, many things in that area you can talk about. You can demonstrate your leadership quality. Leading a team of fellow students is not an easy feat. So how do you lead that team? How do you actually demonstrate to them that you're the right kind of leaders that can actually help them to achieve a vision that aligns with the organization value? So these are the kind of things you can actually even document in your supporting statement. So like I've mentioned to you, so being ready, being prepared for the challenges coming ahead of you, particularly in terms of your application. And along this as well will come that core difficulties you will encounter. Attending interviews. Interviews are not cheap. What is the average cost of an interview? I will say to you, using my experience from people I've worked with, I've known so far someone that will probably say at most you should have a budget of at least £1,000 if you're being serious about your interview. So having a moderate budget of between 500 to £1,000 in place is the starting point for your interview. So what does this actually mean? For instance, you put forward an application. If you're very lucky now, some of the trusts like Sheffield Teaching Hospital, Derby, for example, some of those trusts are actually now putting interview date on the job. So you're able to see and plan ahead just in case they call you. So you can have a ticket already purchased in a way whereby you can cancel it if you were never successful in your application. At least that will save you money. Because what happened is, what some of these trusts are doing now is, because they put an interview date in there, if the job is scheduled to close on the 26th, the job will close. No, if the job is scheduled to close on the 21st and the interview is scheduled for the 26th, as soon as the job closes, you have about 3 to 4 days to prepare yourself for interview. And irrespective of wherever you're living, unless the interview is scheduled for virtual, they expect you to be there. And you can put a virtual request to them and they can also decline. So they expect you to be there. So in that case, you actually have to be in interview mode at all times, being ready for interview, and also being prepared that whatever application you're submitting, you will be called for an interview irrespective. So that should always be your mindset from the go. So first thing, just as I've mentioned, to reiterate, your application should commence before you enter your dissertation phase. If you're not already working in the NHS, either or within your 20 hours restriction, or within any challenging within any rules within the NHS. So being very, very proactive in terms of your application, and being very, very strict on yourself. To be very, very clear here, you have to be very, very strict and diligent. And being strict is about, knowing that your time is just as valuable now. And by valuing your time, you're able to maximize your potentials and opportunities that you have for yourself when it comes to your opportunities and applications. So then that takes me on to the next question about how to search for COS role. So why is this very important? Now, this is something that I find really, really quite interesting. Um, so just before I go into this, does anyone have any question? I've seen Bamidele, I said, I need clarification around salary requirement for sponsored role outside the home office list of needed roles like artisan, builder, DJ, or care. So yeah, we will be going through that as well. There's series of lists I'll be going through today where you can see those opportunities there. So does anyone have any questions you want to put forward within this area of when to start applying for your role before I move on to the next part? Okay, right. I'll pick your question up if you do put them forward in the chat box. Um, okay, so how to search for COS roles in NHS. Now, there's this is very, very important actually. And the reason for this is because I know some of you would have had experiences which is rather surprising to you in many ways because you would have gone down the trust, and I've heard this on numerous occasions where you would have seen the job applications at bottom of it is being stated in there to say, certificate of sponsorship is provided, you can apply under the further details they've put in there, and only for you to then get into the job interview, or in some circumstances you've secured the job and then they subsequently inform you that they do not sponsor. Now, why is this the case? I think a lot of people need to understand something. The track you see as an applicant is different from the track your recruiting managers have, and it's different from the track that the HR use. So there's two types of track. You have a track of an applicant, which is the broad one, and there is the track of the administrative, which is where they set up the job specifications, they set up the requirement of the role. Do they need driver's license? Do they? So there is a broad operational side of track which you don't get to see. You get to see the user friendly one, which is the one you put forward your application on. And when you see all the information on those job around the fact of, okay, yes, we have certificate of sponsorship available, that is not always the case. And you then get surprised when you get into your interview only to find out that these people, but they can't sponsor. I will like to say to you, you know without making a case or trying to defend senior NHS manager like myself or other people, this is not a case whereby you've been lied to. It's the fact that the way the track is being set up is designed to regenerate an application and regenerate previous information that has been put in the system. So if the recruiting officer or the HR department that is putting the job out for final authorization on behalf of the manager, recruiting manager, if they're not quite observant and diligent in their approach to the applications, you will end up seeing some of these repeated informations around certificate of sponsorship available to you, whereas it's not the case. Which is why a lot of trust now are putting series of caveats in there about, please do not apply. This job do not have requirement for COS, or we cannot sponsor on this role. So some trust now are now quite very much aware of these mistakes happening, and they're putting in measures to rectify it, even though not all the trust are doing it. So the ones that are doing it now, I've seen the clear evidence of cases whereby they've recruited someone only to find out down the line that yes, the person might have felt misled because they thought they could sponsor them, and both of them are stuck in this kind of relationship that doesn't work. So what are we actually talking about here? So let me quickly run you through an example of a situation where you might have seen something of this kind. So let's look at this for example. Um, so let me give you a typical example of an incident you might experience in that regard. Um, let me sort of run you through. So let's say you want to give yourself a fair opportunity. Let me remove London for example. We've searched for a job now. We've just gone to a band 4, band 5, and you've searched for jobs now, and you're going around looking for these roles. We're looking at new jobs depending on whichever approach you take. The reason why I actually favor these websites over track is because of the opportunity for navigation that comes with it. So look at what happens here, for example. Now you've gone into this place, now you're searching for job. Um searching for jobs, you're looking at jobs, you're searching, just carry on watching what I'm doing. And all of a sudden you've come across a job that is an administrative role. I'm still searching. I'm just assuming. I'm just acting like anyone in here. I'm acting like anyone in here, and I'm hoping these are the kind of things you yourself you get to see or experience. Now you've looked at this kind of job. Now you said, okay, let me see this job. It actually matches my profile, and it's something that I will have interest in doing. Let's look at one for example. We've been searching. Oh, look at what happened now. For example, I'm living in Leeds, or you're living in Harrogate or Bradford. Leeds, they have medical secretary role. It's 26,000 plus. So now let me show you something that you will see that is quite very different when it comes to Leeds, for example. One of the things you notice is you've gone into the Leeds application now, for example. They've gone down. You can see clearly here, they did not tell you anything about COS. So they've made it quite very clear to you they might not be able to sponsor. So there's nothing in there about COS in there. But you've then gone on to carry on, start searching for different you've maintained approach. You're still looking at different trust. So you what have you done now? So you've come up as far as, let's say, Birmingham women and children. Now, okay, so this is a very good example. So you've come up to Birmingham women and children. So a lot of you will look at this job now, a band five management accountant, Birmingham's Women's and Children's Hospital. All of a sudden you're scrolling down, but guess what? You have all the qualification, you have experience with SBS Oracle, you have the financial knowledge, you know about, budget utilizations, all those things, tracking of budgets, closing gaps, pay and non-pay. You have that great deal of information on them. So what then happen is you're looking at this job from Birmingham. You've seen that, oh, there's COS with the job. Can I just break the news to you? This job is a band five in Birmingham. It's 29,970. So you've looked at the job, you're quite very positive, you have experience. Let's say, in a glamorous situation, you've come to UK, you've done accounting as your masters, you've got wealth of experience in accounting in Nigeria, you've gone on to do all sort of training in UK, all the relevant training that are relevant in the field of accounting. You've done your CCAB, you've done your CIMA qualification, you've got the ATT, and you're part of various organizations, and you've put your application forward for this role. Sincerely speaking, this was a mistake. This from Birmingham is or was a mistake, because this role itself, under the current legislation, still doesn't meet the threshold for sponsorship. And this is why it could meet threshold for sponsorship and it might not meet threshold for sponsorship. And there's two things involved here. Number one, if you're new to the NHS and they recruit you on this role, your starting salary will be 29,970. You are a student. Your salary as it stands does not meet the threshold for the 30,960 unless this job falls within the shortage occupation list. If this job as it stands right now that you're looking at does not fall under the shortage occupation list, there's nothing they can do to help you out. The other option, however, is now if you were to be recruited and you're a very brilliant candidate that they've exhausted every means available to them, they cannot afford to let you go because you could be a likable person, your manager is willing to go beyond and above for you, cherished the fact that they've known you and all the work you've done. What could they do for you? There's one options there, but not a lot of managers will do it because of the risk that comes with this kind of thing. Is unless they move your salary from your starting entry point, which is always the case in NHS, irrespective, unless they move your salary from the starting entry point of the 29,970 to 30,960. But that carries a risk for the manager. If you were recruited into that position and they did something of that kind for you, if they were to do something of that kind for you, and you have someone in the trust that has been working over a year who is still on the same starting salary as you, now you've been upgraded before them. And if that individual were to find out, definitely there would have been unfairness in that department. So anyone that is doing that for you, either manager or HR, they will be doing you a massive favor, which cannot be disclosed, shared, or discussed with anybody. So if they were to do you that favor outside of the shortage occupation list and they decide to go down the path um, of the new entrance pathway for you as an international student, they will be sponsoring you on this specific ground. And by sponsoring you on this specific ground, what that means in effect is moving your salary above the 30,000 threshold to give you an advantage over others. So you have to be very, very careful when you're selecting roles, trying to know which of these roles fits into which area. So we've looked at that now as a typical example of a job that does actually have a statement written in there saying certificate of sponsorship from seekers who require skilled worker visas to work in the UK are welcome and will be considered along other application. If you're an individual that you're already on your post study and you think this job is your pathway to sponsorship, this could be further from the truth. And in effect, you might then have to do this role for maybe another 6 months before you move on to pursue another opportunity that will give you sponsorship. So, this is one element of where your strategy could be wrong. And in order to prevent that, and know how to search for sponsored roles, what you can then do in this case. So let me give you an example of what we can actually do here. Let's say we want to be sponsorship focused. This is one thing you can actually do. Now there is a serious danger here in the sense that because of the limitations that come with this salary threshold, you have one or two options available to you. Is either pursuing your sponsorship in London or you're looking for higher banding roles. So, by the way, I'm not talking about people that are dependents now, because if you're a dependent, the story is even more worse. So, I'm just focusing on students. If you're a dependent, it's even more worse. So, um, and when I say it's even more worse as a dependent, is if you're a dependent of someone that is on student or post study, your best way forward out of this thing is to let the person that is the student just be the one looking for the job, particularly in the NHS. You, the dependent, you can also be looking for a job in the NHS, but do not think your sponsorship opportunity will come from you unless there's a changes in dynamics, particularly you've been in the NHS before the person and then you've gone on to attain various senior higher managerial position that will then lead you to the path of sponsorship. So you have to be quite very strategic. If you need sponsorship urgently, the person that best serves that opportunity is the one that is the student. So if you want to then say, okay, look, in desperate need of sponsorship, what do I do? So there are numbers of trusts that I've put out in the past in London, and these hospitals are hospitals within the high cost living areas. So if you now find yourself in these areas, so you can see again, there are two types of London. There is the inner London and the outer London. So the areas where you see the high cost living allowance allocated to the salaries are the areas where you can see now. So if you look at this hospital, this is a band for diabetes health and wellness coach. It is in West London. And this is an area that falls under the shortage this is an area that falls under the high cost um allowance area. So let me give you an idea of what I'm talking about. So just look at it now. You have this salary threshold already spelled out, 31,000 inclusive, annual inclusive of the ACA. So your starting salary ideally is 26,000 for band 4. But because of the high cost allowance that has now been added on top of your payment, that has now moved your salary into the 31,000 threshold. This, for example, will be the kind of role if it's another administrative, which is a non quasi clinical role, such as the one you have here. If this is a role that falls outside of this area in London, any other roles of this kind, which I will take you through. So I'll give you an example again. So let's look at this job, for example. What do you have here now? Cancer Pathway Navigator. You've got customer support technician. Even though it's a temporary role, it's a secondment 10 months. But Cancer Pathway Navigator, for example, which is a role a lot of you can actually go into. Yes, it's a fixed term, but it could become a permanent term opportunity. This is in Illingdon in Uxbridge, and anyone that knows London or you're quite familiar with London, definitely Uxbridge is within the high cost living area. So they pay you 31,000 for these kind of roles. Oh, bear with me a second, actually. Let me make sure. Yes. So if you look at the role now, the Cancer Pathway Navigator in Illingdon Hospital, it falls within the high cost living area. It's actually a 2 years role. So it's a role you can actually take up, and there's no reason why you should be doing any job for more than 6 to 7 months anyway. So you're not going to be there for 2 years. So it's a role you can take up. So if you look at this job, this is a very, very good job for you. If they offer you sponsorship on this 2 years pathway, why not take it? You're not going to be doing, and then you move on to your band five. And the good thing about NHS sponsorship is you transfer your sponsorship to another hospital. So it's not a case whereby your sponsorship is abandoned because you've now moved into another NHS trust. So when you are working in the NHS and you've been sponsored, when you move into another hospital, your sponsorship is transferred into the new hospital. So, for example, if you were to obtain a band 5 now, even if your band 5 falls outside of the shortage occupation list or it falls outside of the 30,000 threshold, your sponsorship will still exist, will still be as valid as though you're working under the existing sponsorship you are. So you will be able to move to a band 5, even though your band 5 could be in Sheffield, which is 29,000, far lower than the 31,000 for band 4 because of the differences in pay based on regional area. You will still be able to move that sponsorship on, perhaps, with lower cost of living in those areas, and in turn, you'll be taking a pay cut to in some parts because your band 4 in London is about 31,000, whereas your band 5 outside of London is about 29,000. So, looking at that from that angle, you will be able to see series of jobs opportunities that are there in London, particularly that serve the purpose of giving you sponsorship immediately. So, what do I actually mean? How do you actually go about searching for this role? So if your key target is sponsorship, these are the numbers of hospitals you should be looking out for, particularly in London. You start with your guys and St. Thomas's. You start with University College London. You start with Imperial. You start with Royal Marsden. You start with Lewisham. You start with um, Illingdon, for example. You then go on to other hospitals like Northeast London Foundation Trust. You start with King's College as well. You then start looking at hospitals of this kind. Royal Free is also one of the hospitals that will give you that opportunity. And also, which other hospitals are there as well that will give you? Croydon is also another hospital that will give you the opportunity for the sponsorship on the 30,960 pathway because of the salary threshold. Barking, Avery, and Redbridge Hospital is another hospital you should be looking out for. They have sites in different areas. Um, by the way, the likes of Hertfordshire, even though they are categorized within London, these hospitals do not fall within the London There is a pay gap between both areas as well, which I need to clarify. So it is between 5 to 15%, if I am correct. So let's look at it. For example, you will see this job in Hertfordshire, for example, even though it's a band 4, the only percentage which you will be paid in this area is 5% on top of your salary as part of the high cost, because it's considered to be a bit outside of London, not within the actual locality. So even if they were to move you to the extreme end of your salary, you will still not be able to meet the criteria for sponsorship, because you will still not be able to meet the 30,960 irrespectives, because they've already done all the necessary 5% calculation on top of your income. So being very, very strategic, being very, very focused, laser focused on the kind of hospitals you'll be applying for is always going to be very, very crucial in getting that sponsorship done as soon as possible. So let's go back to the list I was giving you before so you can understand where I'm coming from. So West London NHS Foundation Trust is also another hospital as well that will give you that opportunity for sponsorship. And you can also look at Central and Northwest London. So there's quite a great deal of hospitals in London that will give you that opportunity. Epsom and St. Helier is another hospital as well that falls within that category. So, so as you can see, there are numbers of hospitals now. Um, so there's Royal Free, um, Royal London as well. Um, yes, another hospital, Oxley's as well. Oxley also falls within that area. They will give you that opportunity for sponsorship. So, if you actually target all these hospitals with your supporting statement or looking directly for when they have opportunities or jobs opening, if you focus on these hospitals and you actually start pushing forward with applications towards this direction, you're definitely bound when those opportunities come. You've actually laid down the foundation upon which your sponsorship discussion becomes easier. So, number one, what does that actually mean? First and foremost, the salary threshold is no longer a discussion. Secondly, is now the case whereby does the hospitals have the desire and passion to sponsor the role? Have you met the right manager that will support you with all the necessary level of clout they have with the HR to push it through to get you sponsored? So those are the kind of things you need to first and foremost push out of the way. And the first thing you need to find a way to push out of the way is meet the salary threshold first, and the discussion for the sponsorship comes after. Until that is met, you are actually at the mercy of whoever is going to help you, being very kind, willing to break the rules or bend the rules for you, either through backdoors agreements, moving you up the salary scale, or in any circumstances, find a way whereby they might have to redraw the job description to meet with the shortage occupation list so they can sponsor you. So all these things are quite complicated, and there are not a lot of managers that are willing to put their hand into that kind of thing because of the implication, especially if you're one of those people that cannot keep secrets and do not understand the principles of confidentiality, not just even in your job, even in your own personal life. So, and you end up putting the manager in a major problem. So these are the numbers of hospitals, just as I've mentioned: Epsom and St. Helier, King's College, University College London, Royal Free, Barking and Avery, West London, North East London. um so if you watch this video back, you will see all the hospitals we've gone through that have a great deal of opportunities and pathway towards sponsorship. Illington as well. So these are that is the first strategy on how to search for NHS COS sponsored role, rather than blindly searching for it on the basis of the fact that you've seen a COS written on the job and you presume that such role will come with COS. Having additional information where COS is being written underneath does not equate to the job being a sponsored role. The first thing you need to be watching out for is the salary threshold, and also salary threshold number one, and also does the job falls within the shortage occupation list. But your first priority is always going to be the salary threshold. So let's go to the second point, shortage occupation list review. So which is the part that was raised by Bamidele, but I know him as Sam. So right. I'm not sure how many of you are quite familiar with this page. A lot of you should know about this by now. A lot of you should know about this page by now, which is the skilled worker visa eligible occupation code. So this is where you search for all your so can I just suggest as well, if you're enjoying this session, please do like, thumbs up, put your reaction in the chat history as well. Also prepare all your questions. So we're going to be coming to some question time soon. If at any point you have any questions, please do feel free to ask me. Put your question in the chat and I'll pick it up. So a lot of you should be aware of this now. If you're not aware of it, so please, you can see the page, you can see the website. Do go on there and search for all the roles. You will see all tons of jobs opportunities that are there, that have their code there. You will also see the jobs that do not fall under sponsored opportunity. And given the changes that has just taken place recently around the salary threshold, hopefully just to come into a discussion with you, and I will have a chat with you about some of the challenges that are actually happening in the NHS now, because there's something that we've not talked about. And also, I've got a webinar coming up on the 25th of, I think it's 24th, 25th of May. Either of those days, I'll put it. That will be the typical Teams webinar we used to have, where we will get together again. Where I will be discussing some of the challenges NHS is facing right now. And I think there's a major, um, I'm really afraid to say there's a major challenge coming up right on the way now. There's a massive job freeze in the NHS now. There's now discussions about freezing a lot of administrative rollouts. They're trying to get back into the pre-COVID level of vacancies, or workforce rather. So that has put a lot of pressure on a lot of hospitals to go about workforce reduction. But I will not get into that now. We will talk about that. So which is why I'm also having this discussion with you today. So let's look at some of the key things in here. These are part of the areas where you get to search for your roles. And there's a question that was asked by Sam in terms of artisan DJ builders. And one thing I actually want to show you is that there is a specific job which, if you're not sure about, how do you go and search for it? So there's this particular website in here. So instead of you actually going through all these tons of code, if you have the time, you can print it out and scroll through it and see where you fall under. You see the cascode occupation coding. If you click on it, that should help you a great deal to do the necessary work you want to do in terms of knowing where you are. And let's take for example now. I'll quickly run you through what you might need to look out for. So as you can see right now, let's say some of you that will be looking for all sort of jobs, and you want to sort of skip through in terms of, okay, I'm going to put my job title in here. Let's look at the job title we are looking for. So let's say, Sam is asking me about builders. Let's say security, for example. If you put it in there, you can see security guard and related occupation. So that is under code 9231. And you can see under that job, what are they saying? The post holder in this group perform occupation not elsewhere classified under 9231. So a security guard, and a lot of you might not even know this. If you go into NHS, for example, there's jobs I'll show you that as well. So this is a job that all you need is your, I don't know what badge people get to do the security job. I don't know. So 9231, for example. So let's go back to the list that we have under the skilled worker visa. So we are looking for 9231. So let's go through 9231 and see what is actually happening on that job. So now, even though this job is highly ranked, it does suggest that they've made changes to it. So it scores as 92. But if you look at it, security guard and related occupation, unfortunately, following some of the changes, they cannot sponsor it. So this job then, if you're going to search for this kind of job in any NHS hospital, you then need to be looking at London-based hospital that have the salary threshold of the 31,000. That is another way you can get outside of this. So you can then see that if you're going through the shortage occupation list, this job will not fit the criteria for it. But there is one job particularly though. Let's see all the other jobs that are coming underneath that have a sponsorship opportunity in there that you might not know about. There is a specific job within the hospital. You will see some. So water and sewage plant operatives, energy plant operatives, these are engineering roles. These are engineering roles, by the way. Um, chemical related operatives. So you can see. So now, customer service supervisor. So if you remember the job I showed you, which is the job in Epson and Centelia. So let me quickly go back to that job and I'll come to it again. So if you remember the job I showed you, which is in Epson. So now what we've identified now is this here. Customer support technician, right? So looking at this job now that is under the shortage occupation list, customer service supervisor 7720. So let me just copy it and put it under the CAS codes and let's see. Customer service supervisor. You can see 7220. So if I were you now, what would I even be doing right now? Let's say I now go back into my NHS job. I'll just put customer service. Look, can you see? Customer service manager, NHS blood transplants, customer service team leader, customer service administrator, customer relationship manager, customer um, relationship manager, customer support, service manager. Even though the threshold is met, service administrator, that's different. So at least you've been able to target jobs that come within customer service, right? So that's one. Market research interviewer, that's also another job that comes with sponsorship. Let me go back on the list, sorry. So that's also another job. Sales supervisor. Aha. Now, how many of you actually know that NHS also have its own restaurants? So all the canteens and restaurants you see in NHS, let's look at let's let me actually just even go there and look at it from that angle of sorry, apologies actually. Okay, so sales. Let's look at sales for example. So the hotels, so on and so forth, are also part of the equations. Shopkeepers, um, air travel assistants, Care workers subject to listed. We're not covering that particularly. We're not looking at anything like that. Teaching assistant, furniture maker. So Sam, you were asking me questions about builders. So for example, you can see furniture makers and other craft woodworkers. So that is under the 5442, right? Yeah, they will definitely come under builders. So that is under the 5442. So as you can see clearly in here, there is a clear evidence that whoever wants to do that, this is how they need to go, right? This is how they need to go. So um bakers, you can see, so the roles are already constructions and builders, plasterers. So if you're now talking about the so-called administrative roles that are very much NHS focused. So if you want to come in here now and say, let's look at it from administration. Oh yeah, so I guess I've been able to cover that. So administration. So if you're looking at this from other point of view to say, okay, look, you want to look for other roles that have administrative function in them. So within your NHS responsibility, you could then be looking at things around your patient pathways. So can you see now business and financial project management professional? So if you're a business manager band 5 in NHS in any hospitals outside either salary threshold is met or not, you can approach your manager, business change manager, clinical trial coordinator, risk manager, business and financial project manager. So you could approach your manager to have that discussion to see if you will be able to get sponsorship under this code. So definitely those opportunities are there. You can also see as well business research and administrative professional, not elsewhere classified. Policy officer, that is a straight away under the 2439. So you can see now which a lot of these area alone, there's majority of about 95% of the job outside of the clinical role in NHS falls under these two key categories. About 95% of the job in NHS falls under these two key categories. So again, you can see business related research professional, intelligence analyst, research in media and entertainment. If you work for NHS digital team, if you work for NHS communication, if you work for any position in that area, you will see that that is where you're going. You see, again, marketing and commercial manager. So those opportunities are already spelled out within a specific role, which you can then pursue in order to get to get everything right for yourself. So now let's look at some of the typical other roles like personal assistant. Let's see, for example. Okay, if you have a role like personal assistant, right? These exclude care workers. So personal assistant is on the 4215. So where do we go here now? So let's just go here and look at something in here. Can you see? Showing you. So the 4215 for personal assistant. So definitely, if you can get yourself any PA role in NHS, either band 3 or band 4, you can easily work yourself into a sponsorship role. You can see company secretary. So these two roles now, PA or company secretary, definitely should be fine. Again, look at this, right? Other administrative occupation not elsewhere listed: business administrator, facilities coordinator, property administrator, and other administrative. So majority of NHS jobs falls within this bracket anyway. So if you then approach it this way, and I will show you the email you will be writing anyway. I'll be showing you that soon. Then you can then see how these works in your favor by approaching it in such a way whereby you have everything laid out for your manager, and all your managers have to do now is just work collaboratively with the HR. Most importantly, the senior HR, not any of your HR advisor, not the band five. It has to be someone above those band five, either they are band sevens or they are band eight, that will help you to get the sponsorship, the COS out of the way. So you do not approach your band five HR advisor. There's two. Okay, so let me tell you how the HR is structured. You have your HR advisors. Those are the guys that deal with the day-to-day communications around collecting your reference. They're the one that will be sending reports to the managers around sicknesses, appraisals, one-to-one meeting, mandatory training, all those ones. But the person you need in this situation are your senior HR personnel who happen to be the very most senior manager in the department that will lay down the foundation upon which the discussions for your COS will be determined, the printing out of your COS and the next phase. So that's the person you need to then approach. It then seems rather that the medical secretary position, on the other hand, has now been taken off the shortage occupation list. Perhaps if you have a very skilled manager that could then reposition the conversation, you could then fall under the company secretary or personal assistant. Because, for example, if your role is categorized as a medical PA, you are a personal assistant anyway. So it just depends on how that job description is being constructed that will determine the way forward in terms of the next course of action. So we've taken that discussion into account, and we've been able to make the necessary progress around jobs around customer service manager, office manager. If you can see as well on the 4141 office manager, a lot of your job, if you're an administration manager, you are definitely probably within the area of an office manager, because some of the things you'll be doing as an office manager, let's come into here, for example. So yeah, so as you can see, give me- so as an office manager, as you can see in here, definitely it's quite clearly written in there. So what are your expectations? What are your responsibility? Clerical supervisors, all those things, office supervisors. So directly supervise, coordinate activities of office staff. That's the job of an administration manager in the NHS. Establish and monitor work schedules to meet the organization requirements. That's definitely the responsibility of an administration manager in the NHS. Liaise with managers and other senior staff to resolve operational problems. Determines or recommends staffing and other needs to meet the organization requirement. Report as required to managerial staff on work related matters. So basically, these are the kind of things that we want to see on your JD, and these are the kind of things that are also written in the responsibility of an office manager within the NHS. So administration manager within the NHS. So definitely you can see that there is a well spelled out expectations of the role which your job description would have met, or even if your job description did not actually feature particularly around that area, there is always an allowance for your manager to always add these kind of things into your JD without having to go through consultation, because any changes that are being made on JD below 10 no more than 10% does not require a consultation. So those are the kind of things you can see in there that then gives you the opportunity to then lay down the foundation for discussions around your sponsorship requirements with your manager. And so you can see example now how I've been able to effectively utilize the shortage occupation list in addition to the Cascode's web page to navigate my sponsorship pursuit. So if I were you in this situation, these are the ways I will be strategizing and I will be making my case for sponsorship and how I will be actually focusing on jobs that have the opportunity to provide me the require to actually give me what I am looking for. So let's go back into so how do you apply for so the next thing I'm looking at now is how do you then apply for how do you apply so if I before I move forward, looking at the shortage occupation list and navigating the processes around it, is there any question? Can you put forward your question in here? Also, just as an expression, if you're enjoying the session, please do put your reaction in the group, in the chat box, and also put thumbs up as well. Do you have any questions around the shortage occupation list? Is there anything you would like me to sort of discuss around it and take forward? Is there any question you would like to ask? So let's take the next 2 minutes. You can put forward your question if you have any question around the shortage occupation list. Great. So let's see. So Bam deleted. Thanks, I didn't word my question where I was asking for the salary requirement outside the short. Yeah. So Sam, I hope I've been able to address your question, particularly around the salary requirement, because some of those salary requirements, like I've mentioned to you, is going to be subject to whoever that individual is in terms of their current status. I'm sure obviously there are various requirements that also applies to the new entrants. I think there is under 25 expectation as well. There's three key criteria you have to meet: a recent graduate of a UK university, under 25 or 26 if I'm correct, and also one other requirement. So if you're able to satisfy those particular criteria, you will definitely be able to get it. So you don't have to meet all the three requirements, you just have to satisfy one or more of those requirements in order to qualify for your sponsorship. So now the thing we're going to be looking at right now is how do I apply for COS after my job offer confirmation with NHS. So we're going to be looking at the email template you need to send. How do you construct that email? So now you've gone to your interview, which a lot of you, I'm sure one way or the other, you've had NHS interview experience. At the forthcoming webinars that I will be hosting, there will be a great deal of discussions around these. And also, please make sure you stay tuned in the group chat because this webinar is is going to be one of those grand webinars as well, which also will mark, if I'm correct, that will be the second or third year of the group. So there will be a great deal of testimonies. Also, please also look out for the website and the necessary publications that will be coming up soon. Um, um, so I'm sure a lot of you would have had NHS experience in terms of some of the challenges that comes with it. The questions you have to face, the pressure, and I think a lot of you usually think going to school in the United Kingdom is challenging until you actually encounter um, the difficulty of actually securing a job. Because one of the things you probably have at the back of your mind is, unlike Nigeria, there's job for everyone. And I would say to you, there's job opportunity available, but are those job easily attaining those job is one of the major thing. And I would say this as well. Some of the things a lot of people in here are not prepared for is the pressure that comes with securing a job. Chances are you probably get a job somewhere you have to relocate, move, change your life around, move away from where you are. Absolute fact. Um, Changing the dynamics of your day-to-day living, getting to reintegrate yourself into a new environment, and also you might have to do this process more than once before you get to the position or the final destination of a sponsored opportunity. So if I give you an example, you might be living in Nottingham, Reading, or anywhere of that kind, and you might end up having to relocate to somewhere like maybe Doncaster, Sheffield, or Manchester, or in any case, Preston. And when you get to Preston, those roles will not come with sponsorship in some circumstances. And you have to then do the same again until you actually fully settled. And these will mean, in the process, some of you that are married would have experienced this. Moving your entire family. If you have kids, you have to disrupt their education, or in any way, you probably have to go there, start the life first before your family come back to join you. So those things are absolutely draining and they put pressure on you. But you know why you've come to the United Kingdom, and these are the kind of things you were not prepared for before departing Nigeria. So that responsibility in terms of trying to get things right in this country is not something that you can take for granted by just assuming that when you're ready, everything will fall in place for you. It doesn't work that way. You must have a strategy, you must plan, and you must prepare yourself for the challenges ahead. And and you're never ever ready for the challenges ahead of you until you actually start facing them in reality. So if you think your school is the most difficult thing you will ever experience in this country, you are actually not ready for you are in for a massive shock, especially when you graduate and you start realizing that you do not a lot of you will never realize the day you left Nigeria to the day you're doing your graduation. You would not be surprised how time flies. And then before you know, you've gone on from having a student visa, which has lasted for a duration of 12 months, to finding yourself receiving your post study visa arriving at your door. And before you know, you've gone on from being a student into a post study, into your post study now counting. And thereon, from that situation, before you actually even realize, the one that your post study landed in front of your door, you're literally on pressure immediately. You're literally under pressure from that day. If you don't have any pathway in place that will lead you towards your sponsorship role, which is, I'm not sure a lot of you have seen the recent BBC documentary where there are people out here touting COS, selling COS to people, and this is why a lot of people fall victim of those kind of individuals. So those of you that have come here, that have been able to be privileged to be part of the group, get to speak to me in any way, you have a clear opportunity which allows you to overcome that asymmetric information that usually sort of is very rife and absolutely distorts the reality for a lot of students. So that opportunity now is what you guys are benefiting from to move on with the necessary steps towards your future. So let's look at what you need to do now. You've arrived in the country, you've gone to your NHS interview, perhaps you've now come to a point whereby you've done all the necessary work around the shortage occupation list, you've gone through the process. Either the job has met the salary threshold or is within the shortage occupation list, and you're very fortunate. One very key point in here, with these as well also comes the necessary fortune and prayer that is needed, that you meet a manager that is willing, supportive, and also like you enough to go beyond and above for you. So you've come to meet all these criteria are satisfied. So what do you do next? How do you approach the discussion with your manager? Your manager is someone that is willing and is also ready to help you, but they want to understand it. They want you to walk them through the process, and they want you to show them what they need to do in order to have the meeting with the HR. So they do not go into the meeting looking as though they are um, novice in many ways. They probably would not understand it unless the HR is quite skilled, but you expect the HR to know what they're doing. But in all cases, HR don't know everything. So what do you do? Well, I mean, Rukayat, you said, do we still have to plead with the HR? To be honest with you, I will say this to you, right? You still need to work with your manager. Your manager needs to get that over the line for you. And with the support of your manager can get it over the line if the HR is quite very good and there's one or two things that is missing on the JD. So let me share an experience with you. There's been a time where I know a CS needs to be issued out, but a particular line statement was missing from a JD, from that particular JD, which is why that job, even though it qualifies for the sponsored role, the HR couldn't submit it to Home Office because that line is not there. And the conversation came back, I was involved as well, to say, okay, we need to add this line in there, which is not a line that is actually not meant to be in the job. It's a line that is already in the job. It's just because the expectation was you wouldn't put it in the job for that banding because it's a requirement. It is already a prerequisite that whoever is going to take the role have to know how to do that thing. So, but in this case, it's something that needs to feature in there. So we just have to put that line in there, submit it back to the HR, and that went through immediately for sponsorship. So if you're asking me the question about how do you then go about the position of do you have to plead, this is someone that have the power, they can influence the outcome. So whoever have the power and can influence the outcome of what you're looking for is someone you have to submit to. If that's the case, so um they call the shots, just to be very blunt. um so just to be very blunt, they call the shots. And with respect to the question about admin roles will be cut down, um, there's nothing stopping you from there. The NHS is not as ruthless as private sector. What you will tend to see more often now is when the vacancies are coming up, perhaps when people leave a role or a role becomes vacant, rather than re-advertising that role, there's numbers of structural changes that are being asked of various managers to apply. And those structural changes are broadly around, say, for example, can that role be, is it a role that is necessary in terms of patient care, or is it something that the trust can survive without? So there are numbers of discussions that are taking place in that area around reconfigurations and redesigning of the entire workforce structure. So nothing is stopping you from applying to administrative role. Administrative functions will still always be important in the NHS. The only issue that happened was during COVID, a lot of NHS hospitals became bloated. And when I say bloated, I mean a lot of recruitment went on that were specifically meant to be a COVID related role, but never ever winded back into temporary function. So all those things now is what a lot of hospitals now are now trying to get back, with the expectation of the government that a lot of hospitals now, or the NHS as a whole, including the ICB, should be getting back to the pre-COVID workforce arrangements to make sure that it is a true reflection. And I think, with credit to this government, there's been a lot of um, work now being done with patient care, because in the past there were significant amount of strikes. So you could see that the reports that came out when this new government came in was there was a clear evidence that NHS workforce had gone up exponentially, but the numbers of activities and operations being done declined. But what you're seeing now, with the strike now being put to rest, especially with the pay agreement that came into effect, you're now seeing a clear evidence now that there's an uptick in the NHS patients that are being seen. And also, you're seeing a clear evidence now that everyone now is now in a position whereby, yes, a lot of hospitals are making justification for why they need the position, but there's still an expectation that if you can survive with this role, what do you need to do differently? And those are the questions that we ask of you as a senior manager. How can you do things differently? Can you think outside of the box? How long as a department can you survive without this role? What would be the impact on patient care? So unless there is a clear evidence that that role itself that they're making, that they're abolishing or they're trying to take out of the position within the department, unless there's a justification for that role, that will be a situation. I know myself. I mean, I shared the reports about Adam Brooks, where they're expected to cut, is it 500 plus workforce? So um I definitely know myself as well from another trust, where there is an expectations of a specific numbers of people that needs to be reduced in terms of all-time equivalent numbers of staff based on specific area. So I know of friends as well that work in NHS that I've had similar discussion with in terms of expectations. I know there's an ongoing discussions about the ICB also merging and also changing the numbers of. There's a reduction, so there's pressure everywhere, and this is not just limited to NHS. It's also happening in the private sector. Um, so you need to prepare yourself. This is why you need to take your interview seriously, and when opportunities come, please make sure you're well prepared to be the right candidate in that interview room. So what are the things? Um, to say, how do you then approach your manager? You've met the criteria either through shortage of specialist or the other way around in terms of the salary structure. So, what do you need to do now in terms of how you approach your manager? Let me just give you an idea of what you need to get yourself into. Uh, mm, Sorry, bear with me a second. I'm just trying to bring up the email templates that you need to send, and these email templates is what you will be using. Mm, Hmm. Sorry, quite strange actually. Hmm. All right, bear with me a second. So just if in the meantime you want to put your question forward, I'll pick your question now. So I will show you the email template now. So just give me a second. I'm not sure why I couldn't share it, but it should not be that hard for me to pull up. So we are almost there, and I'm sure you will. By the way, I've promised not to gatekeep anything, so you will have opportunity to this video. So just prepare yourself. But again, I'm glad you guys have taken time to attend today. So I always appreciate when I get to see you, I get to speak to you, because um, I know everyone is busy. Um, so just give me 1 second. So we're almost there. Safe to, okay, so I've answered that question before. Uh, Great. Okay. Oh, sorry. Can everyone hear me clearly? Sorry, please. Can you just confirm if you can hear me clearly? Yeah. Wakilat. Can everyone hear me clearly, or is there anything? Yeah. So Lara says she can hear me clearly. Wakilat, yes, loud and clear. Um. Okay. So there's another question. So um. Right. So can you guys hear me clearly, or just to confirm? Um. Right. Yeah, Ellen as well. Yeah, great. So, yeah, Sam as well. So please, if there's any issues with the recording or anything, what you can hear, please do check your internet or check your connection or check your area. Um, So yeah, so just okay, great. So just to pick up on Sam's question, in your opinion, Sai, do you think there will be a change in the landscape regarding sponsored jobs moving forward in Labour governments in and out of the NHS? um, hmm, this is a serious question, and I think is a question that actually will require someone that have insight into the government thinking. What I do know is that because of the pressure on the universities at this point in time, and there's now discussion that there is a possibility that the UK government, under this current labor government, there could be a potential to introduce um, a work arrangement with European Union, meaning that there will be an exchange of workforce, whereas in which case whereby European citizens will be able to come into the UK to work in exchange for UK citizens being able to go to Europe to work. So there will be a one in, one out system that is already been published in one of the news recently. Is an ongoing discussion. Now, as you know, immigration has always been a major pressing issue for this country. If that happens to be the case, they might then substitute the appetite for non-EU workers for EU for European workers because of the proximity to United Kingdom. In the meantime, I think the benefits that international students are still contributing to the United Kingdom in terms of first and foremost the finances for university funding is still playing a key role. But what could happen is in the long term, I do not see how this will change in the sense that I do not see UK government pouring extra money into the university. They will expect them to be able to fund themselves through income generation from international students. If it happens that a lot of international students could not in any capacity be able to stay in UK beyond their academic program, and that starts to have an impact on the inflow of international students, which changes that came into effect around dependent um, and some of the other arrangements that were put in place in terms of salary threshold. If those changes were expanded beyond the current limit and that start having impact on the university's capacity to survive, that could change the dynamics of play. But I think for the next few years, Labour government still have in power, for their first term. I don't know what will happen in the second term. I don't know who will win the election. I'm not an insider, but I think for the duration of this Labour government, I think a lot of international students that are coming in will still stand a fair chance um, of getting things through with their sponsorship. So it's just about being prepared for what the future hold. And those of you that are here, make most of every opportunity that is available to you. I think the people that are coming after you, I would rather not worried about them now until they get to that stage because I don't know because the policy changed from um, day to day. And I think there's already a review in place for the shortage occupation list. There will be other things the government will try to put in place in order to satisfy the right wing press. So they could be seen as being strict on immigration and the causes of immigration and putting British worker first. So all those things will always try to feature in their approach. But I think for now, there will still be a lot of prioritization for the skilled worker, people that are doing professional jobs, and try to find a way to eliminate the manual roles and some of the roles like healthcare assistant and how best they can get people into the UK to do professional jobs that they lack skills and professionalism around. So I think that's one of the things they will try to do as much as possible. So yeah, I hope I've been able to answer that question. So let me just share now with you the email template. So this is the kind of example of an email you will be expected to write. Um, sorry, about me a second actually. Okay. So if you were to find yourself in a position where you're about to approach your manager, can you see the text clearly? So if you were to find yourself in a position where you are about to approach your manager, you've now secured the roles, you've been able to, dissect all the necessary things I've talked about around number one, your shortage occupation list. Number two, you've gone through the shortage occupation list, you've gone through the necessary process around the salary threshold. What do you then do? You put an email of this kind. This is an email template, quite very broad, straightforward, and in some cases you might have to include the codes here and there. And one of the most important thing is you need the grace and the fortune of your manager, and you need the grace and the fortune of the HR. So you to write something along the line of, I hope this message finds you well. The typical kind of stuff you will write in an email: courteous, professional language. um I want to express my sincere gratitude for the opportunity to join. So the name of the trust, so let's say Epson and St. Heliers, NHS, if it's FT or NHS Trust, as let's say one of the roles we identify during the time was we identified that a position such as a personal assistant will earn you a sponsorship. As a personal assistant, I am very excited about the opportunity to contribute to the role, to the personal assistant, to the, let's say you're working within, you're a personal assistant within the gynecology team, to contribute to the gynecology team and become an integral part of such a significant organization, or departments. In this case, you probably change the wording to departments. I have received all necessary documentation from HR. So this one is talking about you've received all your documentation in terms of, at this point in time, you would have received your unconditional offer, not when you are still receiving your conditional offer. You would have received your unconditional offer, and they've given you your unconditional offer, they've given you your start date, they've given you everything, your induction date, everything is already established, right? So all the necessary documentation from HR, and I'm eagerly awaiting the start of my role. Just as you have that discussion, I'm looking forward to apply my skills and enthusiasm to support the important work of the trust. This is you trying to, massage their ego, make them feel like, I'm keen to be part of you and I'm looking forward to it. And I'm sure you will, because after all the interview process, you've gone to an interview, they put you in front of five assessments, they've given you things to be typing, they've asked you questions that you yourself, you don't even know how you managed to get the words out. And people that have been through to tell you, there are times where I've sat down with people after that interview and I'm saying, let's see what comes out of it. And many times than often, I'm sure many guys that are here today are people that I know that I've been privileged to work with, and I'm very grateful for the outcome and the journey and the role I've been able to play in that area. However, I would like to bring to your attention a specific requirement related to my work authorization. So you don't have to go in out and just start spelling it out to say, I cannot work, I have this limitation. So you put it in a professional language, which is simply as I put it in here. I would like to bring your attention to a specific requirement related to my work authorization. As a recent graduate currently on a graduate visa route, I am hoping for a more permanent solution that will allow me to fully commit to my responsibility at Epson and Centelia NHS Trust for the long term. Now, you've left the conversation in there, then you go on with this in mind. I kindly request your support in conjunction with HR in sponsoring me for skilled worker visa based on the Home Office guidelines. Now, which of these guidelines are you going by? This is where you have to be very, very, very specific. Based on the Home Office guidelines, which based on the Home Office guideline, I believe I am qualified for the new entrant sponsorship pathway, considering the status of the job and the salary threshold. So, the status of the job. Now, if you're going for the PA role, if you remember when we said the PA role as it stands, let me remind you, right? So, the personal assistant, and we identify it to be one of those roles that is under the 4215, right? Which qualify for sponsorship. So, let me share my screen again so you can remember. Then, so personal assistance, for example, is on 4215, which we identify that under the shortage occupation list on the 4215, personal assistants qualify for the sponsorship. So if you now want to, you're sending your email, right? You're sending your email. So let me back to the email. So what do you then do now? So now you've got your email. Then you say to them, consider the status of the job and the salary threshold, which is over the 30,960. If the jobs meets the 31,000, let's say you're applying to some of the hospitals in London I've listed, 30,960 requirement, and myself as a recent graduate, this pathway will allow me to work beyond the current expiration of my current visa expiration date and further strengthen my commitment to the department and the trust. And I hope I can secure your support on this matter. Now, you've used the 30,000 as your pathway. Oh, excuse me. If this is a band 3 job, for instance, you cannot use the 30,000 as your pathway. You need to use the specific code of 4215 if your job is a PA role, because no band 3 role will get you to 30,960. Even best case scenario, band 3 in London is about 28,000 thereabout. So remember what I told you, unless they move your salary up, but no managers will dare do that. There will be managers that will do that, but they have to be very careful. So based on that specific requirement of your 30,960 is what you're going for if your job is a band 4 in London high cost living area hospitals. If it's a job of that does not meet that requirement, what you're looking for specifically is the status of the job, i.e., 4215 under the shortage occupation list with this evidence from that website, evidence from the website, and the code being attached to your manager so your manager can know what they are referring to when they are sending the email on your behalf to HR. And what HR2 will refer to make sure that the information they need for the application for your COS is well within the job description they've written for that hospital. Or if there's anything they need to quickly amend before they submit a job application, because before they submit a sponsorship application for you with their job description not meeting the requirement. Because also remember, the job description have to meet the requirement. Just because a job title qualify for sponsorship does not mean your description of that role still not important. The description of the responsibility of the role is just as important as the job title when they are submitting your application for COS. And then you go on to, I am more than willing to provide any necessary documentation or information to facilitate this process. Your support in this matter will mean a great deal to me, and I am certain it will further strengthen my commitment as part of my plan to commit my career journey to the hospital, Epsom and St. Helier NHS Foundation Trust. Now, you're the one that know this to yourself. Whether you're staying there for 6 months, 7 months, 8 months is none of nobody's business. Is between you, yourself, and your own personal life. So whatever you do, if they sponsor you and you want to move to another hospital, so be it. If um if they are sponsoring you and you want to stay there forever, c'est la vie. That's life, is your choice. So it depends on how you approach that discussion. And you've done all the necessary things in the email now. So once again, I am truly grateful for this exciting opportunity. I look forward to discussing any next steps regarding both the visa process and my potential start date. Right? Warm regards. So this email goes to your manager. Definitely, there's no way you send a constructive email like this to a senior manager and they will not be willing to help you. Definitely, unless there's a clear case that you've gone into an area where there is, in you know what I'm trying to say in here. I don't want to spell it out because it's a live stream. They're just the kind of people that they're just, when the desired is not available, then the available becomes the desired. So basically, you're just the available. So that's why you've been desired for the role. So it's not like the person they want actually is just not around. So if you can, I suppose you can dissect that statement and interpret it in the way I'm going. But if you are there desired and you are available, with this kind of email sent to your manager, most definitely the manager will be keen to keep you in the role, because they know if they sponsor you for 3 to 5 years, they know at least for the next 5 years, chances of you even leaving is even slim, because they can be rest assured, especially if it's a department where they struggle with retention. You know, if it's a department where they struggle with staff retention, particularly with people, because what some of the jobs in the NHS, a lot of people use specific job into the NHS to climb up the ladder. So if it's one of those departments that struggle significantly with retention, and they know they can sponsor an international student to become a permanent staff with a long-standing commitment of the next 3 to 5 years, they will not hesitate at all. Your managers will be the first person to jump on that bandwagon to go to the HR to say, I need this person there, because they know that at least there's one role in my department for the next 3 to 5 years. I'm secured. I don't have to be worried about me doing recruitment again, training someone from scratch. Unless, like I mentioned to you, if it's one of those areas where, they always have their desired, but their desired is never available. So you that you are the available, you just become the desired. You will always find a bit of pushback and some one way or the other kind of, behaviors that are absolutely appalling or unpleasant in that area. So, but overall, I can say with my experience and background in the NHS, majority of NHS managers are groomed to be compassionate individual, and they are actually, as with my experience and background, there are bad eggs there. Don't get me wrong. I've had a fair share of my experiences. If I tell you my years of service in the NHS, you definitely would have known that I've had experiences that are unpleasant in some circumstances. But if you look at it overall, looking at the bigger picture, majority of time you will find money, you will find yourself in a position whereby even if you were to depart the trust, the managers you will encounter and meet up with are people that you will maintain that relationship with them beyond your years of service in that trust. That's my relationship to date with a lot of managers I've worked with. I still go to some of those hospitals to visit them, and we catch up regularly on Teams, even though I've left the trust, to see what's going on. And and those are the kind of things you will experience in some circumstances. But having said that, please do not take away the fact that there are some unpleasant people, and not just managers as well, because um junior staff, there's a series of behaviors you will encounter from people that are not pleasant. But part of your journey in life is to always find a way to overcome these things. And I hope God continues to strengthen you with all the struggles you've gone through leaving Nigeria, coming to UK. And I pray God continues to strengthen you, to guide you and support you, to have the fortitude and ability to undo any situation you encounter. And in this your journey, I hope God makes it smooth for you. So that's the best I can wish and hope for you in this situation, because I know you're facing is a very, very tough situation. I've been through masters myself. I was never an international student per se, but I've been through the master's program myself, and I have friends that were international students at the time. I don't think the visa was well relaxed now, but where they had to go back after their school. And I know how much you've invested in yourself till dates, not just your school fees, your accommodation, changes in family arrangements. Some of you, you've left your wife or husband in Nigeria, and in some circumstances, you've brought your children here. Some of you are far away from them because you have to work in different locations. But yeah, but you're still trying to make it through, and I'm sure it will all end in praise, by God's grace. So these are the kind of things I hope from this presentation today is being able to help you, guide you, and show you the way forward in terms of what you need to do in this your particular endeavor and what you're trying to achieve. And I hope by the time you get to see this video again, you can find it to be worthwhile and also provide you with the necessary support. One thing I would do is these. In case you're not aware, if you're not part of the group, you can feel free to drop me a message. Let me just stop sharing that. Let me share my screen now. So this is the contact details. Like I've mentioned to you. So please, in the meantime, the Gmail account is still functional. This is the Instagram page if you want to follow. You will see a lot of materials and contents being published. That is my WhatsApp number. Give me a second. That is my WhatsApp number. For some of you, if you're not part of the group, there is a specific requirement for joining the group, by the way. So, but that's something we discuss later. So that's the contact details for the group. And what else do I need to share with you? I think this journey um is something that I can, I've had a very, very beautiful experience with some of the guys I've worked with, and I continue to take pride in that opportunity that I've been able to contribute a bit of my own quota to developing our community. And I hope we can carry on with this success. And I'm sure many, many testimonies are coming forward soon. I'm sure at the next webinar that will be held in May, you will hear a wealth of testimonies, and people will share their experiences, the journey they've gone through, what actually was the thing that helped them to where they are now. So thank you guys. I hope you found the session quite helpful in many ways. If you have any questions, please do feel free to contact me using the number on the screen. You can also follow the Instagram page. That is the email address as well. Like I've mentioned to you, there will be a website to be published soon. A great deal of informations are coming up soon. So um, if you have any questions, please, I will say it's 3 o'clock now. I'll spend the next 15 minutes, 15 to 20 minutes to just answer your questions. Please remember, to be able to ask questions, you will need to be subscribed, and also subscribe at least for a minute so before you can put your question in. Great. So right. So I'll just spend the next 5 to about 15 minutes or so. Uh, so we are 3 o'clock now. So let's say about 3:15, 3:30. Let's put your question forward, please. If you have any questions, please do type your questions in the chat box. Also, as well, please do like and also put some reactions out there just as an appreciation if you've enjoyed today's session. So please do uh yeah, so if you have any questions, please do put your question forward. However, if you like to have a private conversation or private chats, please do feel free to take up the number and drop me a message. So I'm just gonna spend the next few minutes to say right. Thank you so much, Wakilat. Thanks for the recognition. So, does anyone have any questions you would like to ask? If you have any questions, okay. So, whilst I'm waiting for you to put your questions together, one of the things I said I will also mention to you in terms of the challenges that are coming up. I know you've mentioned some of you have asked me questions around the pressure that will be coming up in the NHS in terms of administrative jobs. Um, what do I think is going to happen in terms of some of the changes the government, or not just the government, in terms of some of the pressure that is happening right now within the NHS? Is that, see, if I've had experience, and I've had good experience, and I've had some challenging experience with people. Some of you, we have interview requests and you treat it as a jest. You probably think, oh yeah, when I get there, it doesn't matter, or whatever the situation might be. Or you just think, well, don't worry, I will go for another one. I can't go to this one, it's too far away. One of the things I would say now, because of some of the things that is happening now, please, the day you're submitting any NHS application, always have the mindset that whatever irrespective of the hospital you're submitting to, be prepared that for fact that job they will call you for interview, and treat your interview as though is a mission must be accomplished. It is a mission that must be accomplished. And make an attempt as much as possible to pass your interview by doing the necessary preparation. If you go back to series of videos on the YouTube page, you will see method and strategies for passing NHS interview. So those are the kind of things you need to start preparing yourself towards now. Oguchi is asking a question: when is the best time to ask for sponsorship? If someone's visa has some allowance, would it be better to accept the offer first, and ask sponsorship later? Well, I mean, look, I think some of the strategy around here, it depends on you. So let me give you a typical scenario. If you're someone that have secured a band 4 role, let's say your band 4 is in London, which means the salary threshold for sponsorship on the 30,960 pathway. Now, if you've secured a band 4 role in that area, you could, and your visa, your post study, you're about to enter post study, or you've entered your post study, and you've only used about, let's say your post study is, you've only used about 1 month before you start your role. Now, ideally, you've got 24 months. You do that job for about 6 to 7 months. So within your six, again, don't be reckless with your holiday, right? You've done that job for about 6 to 7 months. Now, 6 to 7 months, you can still stay within that same London and start applying for band 5, which is 35,000 and above in London, or you can go for your band 6 anywhere else. 4 to 6 is mostly the kind of necessary career progression. 4 to 5 is the typical standard progression. 4 to 6 is the expected progression, and 5 to 7 is the expected progression. 5 to 6 is your customary expectation. So if you were to have your band 4 in London at 31,000, you could make the decision to say, okay, perhaps you're one of those people that just don't like to stress yourself. If you're happy to settle for something like that, you can take the band 4 and get sponsored on that band 4. However, if you say to yourself, look, my post study still have 23 months, I'm only doing this job for about 6 months, I'm going to acquire all the necessary skills I need, then you go on to your band 6 outside of London, perhaps any area, or you want to stay within London, you get your band 5 in hospitals in London with the 30,000 and above threshold in within the high cost area, then you get your sponsored opportunity. So it's always a choice. There will always be a choice you have to make. Either you want to accept sponsorship at the first offer, but if you're happy as an individual, some of the things I've said in here is for those individuals that are significantly pressed for sponsorship. They, for whatever decisions or reasons of the, whether intentional or unintentional, that have led to a circumstances where they are now significantly pressed for sponsorship. Those individuals are the people that will be using this strategy of taking sponsorship at the first opportunity that come, looking at roles within the shortage occupation list. But some of you that still have a great deal of time, you have that leverage of utilizing your visa to gain the necessary skills and go on to your managerial position at higher banding, your 5, 6, and 7 roles within the NHS. Don't be surprised. It's doable. You can go from your band 4 to band 6 within 8 months, and you can go from your band 5 to band 7 within about 6 months, 7 months, thereabouts. See, changing job in the NHS is not that hard. It's always going to be down to you, and there will be numbers of factors that will influence your ability to change your job. So, what are those factors? How flexible are you in terms of relocation? What are the challenges and experience you have in terms of your family arrangement? Those of you that are single, that don't have any commitment to anybody, this is where you have the advantage of roaming around and progressing as, being ruthless as you want, because you don't have that commitment to anyone. So, you can have a short-term accommodation anywhere and move on to the next phase of your life. And when you make the decision to say, okay, look, I'm happy at band 7 or band 8, or I want to still progress from 8 to B, C, D, whatever, if depending on how ruthless you are in terms of your own career objective, that will always influence the point where you say, okay, look, I've reached this area. Look, I've got a band 6 job in Southampton. This area is not bad. The salary is not bad. A decent accommodation I'm living in here. Maybe I want to settle here. That's fine. If you think, you still have another shot at band 7, band 8 in the likes of higher paying areas, you want to move to Sheffield, you want to move to Doncaster, Nottingham, all those areas, you could still have that shot again and say, okay, maybe when I get to Nottingham, I will relax, maybe settle down with someone. Because the moment you settle down, that will also influence what you can do, because you also have to take that person into consideration when you're making that move. So those are the kind of things that will be able to influence, that will influence your decision upon when you should take that sponsorship. I hope I answer your question, Gochi. All right. Purely halal foods. Thank you, Said. This is enlightening. You said it is possible to move to another trust with NHS, within the NHS, with just a COS. Is is this also applicable when the jobs are different roles? Please explain. Okay. Now, this is slightly, I don't want to use the word complicated. It's not complicated, but it's also straightforward. If, for instance, now you were already sponsored on a skilled worker visa, NHS is already sponsoring you at an administrative capacity. Now you started on the visa you are on. When you move to another trust, my understanding and interpretation is you will not need, unless, so listen to me clearly here. If the role is a different role, it wouldn't matter much because you're already sponsored, right? But what they need to do is that under the current terms of your sponsorship, they need to sponsor you based on, let's say you are already, they just need to transfer the sponsorship. They just need to transfer the sponsorship, and not just transferring the sponsorship, they need to do all the necessary paperwork in terms of, okay, look, this job you're applying for, it meets the sponsor, we can sponsor you on it. The first criteria is, do they have the willingness to sponsor you on it? If they can sponsor you on it, then definitely they don't need to do much, as opposed to say you're coming from a fresh experience of, needing sponsorship immediately. They've never been sponsored before. If you've already on a skilled worker visa from NHS trust, it makes life easier because your movement in between NHS trust, remember, you are employed by NHS, you just happen to work for an hospital. Always remember this, right? You are employed by NHS. You just happen to work for an hospital. So if you're working in Reading, or if you're working in Leeds, if you're working in Rotherham, you're working for Rotherham NHS Foundation Trust, but you are NHS employee. So whichever hospital you move to, your years of service will always continue. Because also remember that the COS you're holding, as long as it's sponsored by NHS, is valid. It carries on counting. So it's not a case whereby if you're moving from one NHS trust to another, you'll be starting from scratch. As long as that COS is still within administrative responsibility, you do not have much to do. The HR just needs to do all the necessary paperwork and help you through the necessary process. Um, Purely allowed food. I hope I've been able to answer that question for you. Ugochi, lastly, I had an experience in a band 7 interview where I was told that they cannot offer sponsorship for the role. I would advise to accept such an offer and start pushing for sponsorship later. Absolutely. What do you think? What do you think should happen here? You have a band 7 job offer. They said they cannot sponsor you. If you still have about good, solid, let's say reasonable amount of time, let's say you still have another, give and take, you have another 20 months or 18 months left on your visa. Right now, if you do that band 7 role for about 6 months, even 5 months, within the next six, within do that band 7 role for 5 months, start applying for your band 8, because there's no way, unless you want to be stagnant, you will still apply for band 7 in another hospital. But if you say you apply for a band 7, by the time you go for your next interview, which is your band 8 and onwards, either A or B, whatever the decision may be, by the time you apply to your band 8 within the next 5 to 6 months, um giving yourself a great deal of time of saying you want to spend another 1 month doing an interview. But by the time you get to that level, you will get your sponsorship with the click of a finger. So I don't think, if you have a band 7 offer available to you, w- why would you even bother about if they can sponsor or not? I don't think sponsorship is a major issue here. It's probably, maybe, I don't know why they said they can't sponsor. Maybe they just don't have the desire to sponsor, or I don't know. But if they say they can't sponsor you at a band 7, I wouldn't even care. I wouldn't even care if they can sponsor or not. You're only using them for experience for the next 5 to 6 months, and you're moving on to your next role. So there's nothing stopping you at all. Yeah, so please do take it. Please, absolutely. Absolutely. Yeah. Ugochi, yeah, so I hope I've been able to answer your question. Likewise as well. I will share this video later on. please feel free to share it with your friends and family members, especially those that you know that are in Nigeria that are planning to come to the UK for their post study and for their academic pursuit, particularly masters, anytime soon. So I'm going to take one or two more questions before I leave. Um, Thank you, Chichike. Thank you. Um, I'm going to take one or two more. Right. I'm going to take one or two more questions before I leave. Um, so does anyone have any questions? Because we are about to round up now. Okay, so one of the things I would say is again, for those of you that will probably, if you want to contact me, some of you that already have my contacts, you know how reachable I am. So if you want to contact me, this is my contact details. Um, Obviously, you are aware there's division of operations within company, so you know there's an administrative function which I have direct oversight for, and the IT area that is broadly covered by John. So, and there's numbers of announcements that we've made soon in terms of the plan going forward. You will see some of the changes that are coming into effect in order to expedite the job search easily. Some of you will also notice that there's been a massive reduction in the amount of vacancies available now. In the past, you can go online, you see 60 administrative jobs in a day that are being advertised, whereas now you even struggle to see 10 jobs that are available within the NHS at this present time. So, yeah, so those are the kind of things that are changing particularly. So, in order to make sure you're fully well prepared for your interview, there are numbers of changes that are being made to the operation to make sure that as time is going, as you kickstart your consultation phase, you immediately start getting the necessary support for interview. So great. So on that note, one thing I would say is if there's no more questions from anyone, one thing I would say is it's been a pleasure again having you around. I'm sure and I hope you've benefited a great deal from this session. I hope this session has served the purpose and you've come here to gain wealth of experience and information, and it's also benefited you in the way. And I hope you've not just wasted 2 hours of your time. You found the 2 hours you've given to me today to attend this session, like any other webinars you've attended in the past, to be worthwhile. So thank you so much. It's been an honor and pleasure. I hope to share the video soon. And again, those of you that need to contact me, you know how to reach me. If you need the contact is there. The WhatsApp group is also live, so there's many informations that will be published. And also, please do not forget to like and subscribe. There will be a series of NHS insights materials that will be published on the YouTube page. So great. So thank you so much. Have a very lovely weekend, and I will get to speak to you at some point if you need me. So take care of yourself. Regards. Bye.